greetings from wherever you're joining us across the globe. Ambassador Shinada Chiruhiko, Professor Kenzo Hiroki, Honorable Representative of the Japanese Government and CRIPS, Mr. Trevor Thompson, esteemed representatives from national governments, representatives from Global Water Partnership, prestigious partners of Global Water Partnership Caribbean, distinguished participants, ladies and gentlemen. It is a great honor for me to deliver on behalf of the Global Water Partnership Caribbean this keynote address at this very important consultation. I would like to first congratulate the high-level experts and leaders panel held on water and disasters for leading the effort on water-related disaster risk reduction during these challenging times. The COVID-19 pandemic has been the world's foremost threat over the last 12 months. The deaths and economic devastation triggered by the pandemic have been far more catastrophic than some of the world's natural disasters. The pandemic has magnified the risk to our people, our economies, and our way of life. Here in Guyana, we have responded to the pandemic in a comprehensive, inclusive, integrated, and multifaceted manner. In terms of managing the pandemic, we appointed a broad-based task force, which included medical personnel, the private sector, and other stakeholders. In terms of the health response, we increased testing and significantly increased our capacity to manage the pandemic. We've also strengthened the capacity of our hospitals, especially regional hospitals, to provide medical care for infected persons. In addition, we acquired adequate supplies of protective gear, medical equipment such as ventilators and oxygen concentrators and medication to improve treatment and patient recovery. We have provided support to frontline workers and retrofitted a special infectious disease hospital where seriously ill patients are treated. Contact tracing is being undertaken when cases are identified. We've also prepared a vaccine rollout plan as part of the immunization process, which will commence as soon as vaccines are received. Public education is ongoing in this pandemic. I mention these things to emphasize the fact that a model of a multifaceted and integrated approach to the pandemic may be tailored and adjusted for other types of disasters, including water-related disasters. The pandemic, however, is not the only extant challenge which faces humanity, and therefore it should not divert attention from or diminish the gravity of the threats posed by other risks, including hydrohazards. We in the Caribbean are prone to natural disasters, including water-related natural disasters such as hurricanes, floods, landslides, and the overtopping of city fences and riverbanks. These, along with waterborne diseases, affect human health, destroy and damage the physical infrastructure and other assets, and inflict huge economic costs and loss of human life. We are also familiar with the challenges associated with managing natural disasters. We have had our fair share of these hazards. As we continue to build capacity to respond to these threats, we have learned many lessons in the process. We have also learned a great deal over the past 12 months from the pandemic. The lessons from natural disasters and the pandemic are interconnected. The experience of managing the pandemic has been instructive in terms of how we can better cope with natural disasters and vice versa. Both emphasize the need to pay greater attention to economic and social inequalities. Both urge us to have integrated and multi-sectorial response strategies. Both encourage us to protect scarce medical resources during emergencies and disasters. Both compel us to protect the vulnerable, and both stress the value of regional and international cooperation. The risk from the pandemic, combined with the threats posed by natural disasters, Particularly, the threat of water-related disasters have led to the coining of the term twin risk. The coining of the term twin risk is an important part of our development moving forward. Access to resources, negotiation for new resources, especially for developing countries, is becoming very challenging as much of international resources has been diverted to the pandemic, which will definitely impact our medium and long-term plans on climate adaptation policies and also building risk reduction capacity for natural disasters. As we combat the twin risk of natural disasters and the pandemic, we are also obliged to pursue greater resilience. We have a responsibility to ensure that every country, every organization, and every family rebounds from the pandemic, even as we protect them from other disasters such as hydrohazards. At the level of policymakers, this responsibility requires making choices. These choices often involve protecting human lives while preventing economic debt. Human life is paramount, but livelihoods must also be safeguarded, and the resources mobilized in order to combat other threats if and when they occur. As we contemplate these choices, we should recall the words from an old Belafonte song, Hosanna, where we're reminded that a house built on a weak foundation will not stand, but a house built on a rock foundation, it will stand. If we are to rebound stronger from the pandemic, and if we are to better respond to natural disasters, it is necessary to build robust, resilient foundations of development. These foundations have to include the well-being and empowerment of our citizenry, food security and sovereignty, poverty alleviation, and environmental resilience. Equally important is having robust readiness in disaster risk reduction and emergency response. In the process of preparedness and response readiness, a number of international instruments are extremely helpful. One such instrument is the Sendai Framework of Disaster Risk Reduction. As you may be aware, the Sendai Framework for Disaster Risk Reduction was adopted at the United Nations World Conference on Disaster Risk Reduction in Japan in March 2015 and has been adopted by the United Nations General Assembly. It is aimed at, and I quote, the substantial reduction of disaster risk and losses in lives, livelihoods, and health, and in the economic, physical, social, cultural, and environmental assets of persons, businesses, communities, and countries, end of quote. The framework has a more people-centered approach to disaster risk reduction than its predecessors. If the goal of the framework are to be achieved, it will require countries to mainstream them into national policies, programs, and plans. The second instrument to which I wish to refer is the subject of today's consultation. It is the principles to address water-related disaster risk reduction under the COVID-19 pandemic. It was developed by the high-level experts and leaders panel on water and disasters and acts, I believe, as a timely and relevant complement to the Sendai framework. These principles, have backed by political will, have the potential to help governments and stakeholders to be better prepared to manage water-related disasters during and after the pandemic. It is therefore an indispensable tool for those involved and interested in water-related disaster risk reduction. The principles are tailored to address water-related disasters, but are equally applicable to other types of disasters. They remind us that unless such disasters are properly managed, it can lead to an escalation of the pandemic. It is within this context that I welcome this consultation on the principles to address water-related risk reduction under the COVID-19 pandemic. I look forward to a healthy exchange of ideas and to the generation of insights which can foster not only a better understanding of the principles, but also to engender a determined commitment to further strengthen disaster risk reduction for water-related disasters. I do sincerely hope that this consultation will provide useful insights and contribute to improved management of water-related disaster risk reduction. I wish you a successful consultation. I thank you.